listening to On the Way Home with your host, Michael Braithwaite.
Homelessness, health, meaningful employment, and so on, all these overlapping and intersecting pieces when it comes to preventing and ending homelessness in Canada and creating affordable housing. It's a great place to be, and of course, my organization is Blue Door. Blue Door is an incredible organization working in York region and Durham region, Peel region, helping our most vulnerable in the areas of housing, health, and meaningful employment. Check us out at bluedoor.ca to find out what my incredible team of people that are way more talented than I am doing great stuff. Let's talk about today's guest. I am so jazzed about today's podcast. Such a great conversation with Keirs MacDonald from Coast Mental Health and Rebecca Shields from CMHA York's South Simcoe. Just two brilliant leaders, one on the West Coast, one in Ontario, that beyond this mountain of challenges. It's tough times, and I think we hear about it in the news. We talk about it on the podcast, how it's politicized. Lots of challenges around mental health. So we talk about some of those challenges. We talk about, hey, this is kind of a housing and homelessness podcast. Why are we talking about mental health? Well, of course, there's an intersection there as well. Both organizations for many, many years they've talked about have done in various different ways, have housed people and supported them around their mental health challenges. And we talk about how housing is just key to them moving forward in life as part of the plan. As we talk about that, we talk about the positives. Some great things are happening. Hey, how about this for positive? 30 years ago, no one was talking about mental health. And now all of us, I think, when you talk about it, like, yes, we have a challenge here. We know about it. And that did not come with a great effort from the incredible mental health advocates. Too many to mention, but some incredible people pushing forward, coming up against walls, but continuing to push forward because they cared. Keirs and Rebecca are two of those advocates and leaders. We talk about some of the work that they're doing in their organizations. We talk about what it's looking like in BC and Ontario. And lastly, we talk about some of the cool work they're both doing that's really innovative and different and their hopes for the future. It's a podcast you don't want to miss. We have a long conversation with two of the best when it comes to mental health and housing. I hope you enjoy it as much as I did. Let's go to that conversation now. Rebecca, Keirs, thanks so much for joining the show today. You're both veterans of the podcast. You've been on before, and I'm sure many other podcasts as you are experts in the field. But I am blessed to have you on the show today.
Thanks so much. So great to be here, Michael.
Thanks for having us on.
All right. Now, the benefit of being here before is this. We ask the same question every time you come on, so you've had some practice at it. Maybe it's the same. Maybe it's better. Maybe it's different. Maybe something in your life has changed. And that question, of course, is what does home mean to you? Rebecca, I'm going to give you first shot at this. And then Keirs, because you've been a little more recent, then you could follow up.
I spent a lot of time thinking about this because, I was traveling a lot this summer, and I thought, well, my home is my tent where I'm trying, and that's where I am. And it came to be the place where I want to and meant to be. So that's my answer today.
Love it. Want and meant to be. We've never heard that, and that is awesome. Keirs?
Yeah, it took on a different meaning for me this summer because I was back in Australia, which was home for probably 3 decades for the last month. And so back staying with my mother, with my sisters, it was quite a different thing. So my answer is probably a little bit different this time. But one word that comes to mind more is it's somewhere safe. I don't think I mentioned that last time, but really when I think about being at home, it's being somewhere safe with loved ones and a place where I can rest.
Yeah, 100%, right? I mean, probably when you got off the plane, it's when you finally breathe is when you are home, whatever that home might be, when you're traveling, right? Where you can rest and be safe. So absolutely. We're glad to have you back on the West Coast of Canada doing the great work you're doing. Let's talk a little bit about your journeys into this work. I think, I forget what grade now because I'm getting too old, but at some point during grade school, people ask you, what do you want to be when you grow up? And most of us have no idea. And so we just state, doctor, a fire, like something we see like that, just kind of your average trades or something like that. I want to talk about your journey, and Keir, we'll start with you. Talk just a little bit about your journey into the work you're doing now.
Yeah, it's funny you say about what did you want to be when you grow up, because I don't think really many or any of us think about that when we're in school. You don't hear about the social profit sector as a profession and where you can make a career, and many of us fall into this work. And I guess my journey was a bit winding as well. My early days started off as a young lawyer and really passionate about social justice and human rights, and then moved over to Canada and worked with BC Housing for a number of years, the Crown Corporation responsible for affordable housing and homelessness in BC, but found my way to the social profit sector close to 10 years ago and haven't really looked back. It's, the drive for the work. I mean, housing has always been something I found incredibly important, and recently really grew to understand the incredible needs around mental health and just how much that intersects with other areas of addiction, the justice system, homelessness. So really find myself fortunate today to be involved and leading an organisation like Coast Mental Health that just enables us to do so much work to help others in that area.
So for me, I came from a family of volunteers. For as long as I've known, my dad's been a lion and delivering sleeping bags and coats and bingo halls, and my mother was with the MS. So it was always in my blood to volunteer, and I volunteered for everything. In my sister, we all do it. And but I was doing a degree in chemistry, and then I was doing a master's degree in science, and not happy. Didn't see my place. I felt very lost. And then I had my best friend at uni got a job as a fundraiser, a professional, and I thought, you mean you could get paid for what I'm doing for fun in my volunteer time? I'm like, I want to do that. And I applied, and I was lucky enough, because of all of this amazing volunteer experience I had done over the years, I got the job as the Director of Development and Communications at the Greater Vancouver Food Bank Society. And in the first year, I doubled donations in cash and food. And it was like, this is what I was meant to do as a career. And so my career is also, I've been in the social profit sector my whole life, but in a variety of different social profit organizations, but always really focusing on human services. So I did food security, and I did, developmental and deafblind services. I did a lot of work with youth HIV and AIDS, and then went over, and when I fell into mental health and I got recruited, it was like a light bulb went off, and I thought, everything that I've done, I should have had a mental health lens on. I should have had this lens, because I realized how it intersects with and how we siloed care in the past. And so that's really how I ended up where I am, and why I've stayed for so long in mental health and just love it, and so passionate about supporting mental well-being.
So thank you for that, Rebecca and Keir. Tell me a little bit about your respectful organizations. Rebecca, we'll start with you. And I should mention too, Keir right now is on the West Coast, hailing from Australia, but you were recruited right from the West Coast over to Ontario, and have been here now, it's been 14 years?
12.
12, only 12
years. And so I had the pleasure of being the executive director for the Canadian Mental Health Association when it was a Vancouver Burnaby branch. I know it grew. And then I came over and I became the CEO for the Canadian Mental Health Association in York Region and South Simcoe. And what is unique in Ontario is that there's no health authority, so that the community agencies are the clinical providers. So we are a multidisciplinary team of over 350 amazing dedicated staff. And we have all of the acute mental health community services, such as the sort of community treatment teams, first episode psychosis stream. So just think, working with people who have a serious and persistent mental illness. And that's about 25% of our work. 25% is in housing and housing stability. So we have a housing first team. We have over 420 supported housing units, and whether it's congregate care or people who live independently with supportive housing. 25% of our work is around the new Ontario Structured Psychotherapy Program, and we're the provincial provider for the psychotherapy, the CBT psychotherapy. And then I call the last 25% all of our recovery, our community work. It is our youth programs. It is all our nurse practitioners. It's integrated community care. So it's really innovative programs that help provide care where people are at, and with a lot of exciting services. We're the first organizations embedded in newcomer and refugee centers, so providing direct mental health care there, in the schools. And so we've really looked at how do we bring care to the people where they need it, so that they don't have to find the care. So that's the last part. And of course, at CMHA, all of us, no matter where we are across Canada, are always committed to destigmatizing mental health, providing education, support, outreach, and connection.
Well, I've had a front row seat to seeing all that you and CMHA, because we're in the same region, Keir. So I've had a bit of an advantage with Rebecca seeing it in action. And I got to say, like, it really is incredible. And what's happened under Rebecca's leadership over the last 12 years, it just leaps and bounds and growth and progress, and always just, and not without, because I've talked with her a lot, Rebecca, not without like a lot of blood, sweat, and tears from you and the team of pushing forward in most trying of circumstances. So thank you to you and the team for all you do. Keir, maybe you can tell us a little bit about Coast Mental Health.
Sure. And Rebecca, I didn't realize we had this connection, because who took your role at Vancouver Burnie branch, who was a former colleague of mine, Michael Anhorn, who is now in Toronto.
They're following me.
Now he's followed you out to Ontario now as well. So he's really, always good to see those connections. It is a small world. Coast Mental Health, we've been around for over 50 years, really at the forefront of community-based mental health care in British Columbia. We offer a range of services, including housing, employment, and mental health supports. A really big piece of the work that we do is licensed mental health care. We operate close to 20 of those community-based facilities. We opened the first mental health housing project in BC back in the 1970s, and really came about as a response to the closure of Riverview Psychiatric Hospital, where people moved to community, and there really were no community-based organisations, and it was the CMHAs and the Coast Mental Healths of the world that really stepped in to sort of meet that need. And since then, it's really grown from those those community-based and grassroots supports into more forms of supportive housing, more community-based programs, supports, outreach services, the drop-ins where you can access meals and showers and laundry and all those important things that folks that don't have a home often need to access. And then we've really moved into more of a specialized mental health care piece as well, and increasingly in co-occurring disorders. So, where we're supporting both individuals experiencing mental illness along with substance use disorder. Some of those are justice involved as well. And so we really see so many gaps outside of the health authority system. There's very few community-based organisations that are providing those specialised services. So Coast really, tries to meet that need where we can co-locate services, offer that primary need around housing, but really try and help those other psychosocial supports such as mental health and substance use supports, and help people move forward.
And we're going to stay with you, Keir, because you started down that path too. So you're on the west coast of Canada, in British Columbia, and a little different, I think, if we look at even homelessness and how it appears on the west coast, especially in Vancouver and Victoria and such. Can you paint a picture for our listeners who may not know about what does the mental health picture look like in Western Canada?
Yeah, I mean, if it's okay, I'll just probably give a couple of Canadian stats. Just when we think about the gravity of this situation, and these are probably very familiar to Rebecca, but only 1 in 3 people who need mental health services in Canada actually receive them. Approximately 1 in 5 Canadians will experience a mental health problem or illness in any given year, and by the age of 40, about 50% of Canadians will have or have had a mental illness. So this really is an issue that touches so many of us. Yet there still aren't the systems of care, quite frankly, that are there to respond to that need. And so when we think about the current state of mental health in British Columbia, it really is marked by both challenges and I would say some progress more recently. On the one hand, there has been that growing recognition of the importance of mental health, predominantly through COVID, but leading to that increased awareness. We believe it has led to some stigma reduction and the expansion of services. However, just the demand for mental health services continues to far outpace the available resources in BC, and I'm sure across many parts of the country. Many individuals are facing long wait times, for healthcare in general, but definitely for mental health care. And those with persistent mental illnesses often struggle to find, the comprehensive supports that they need. In urban areas like Vancouver, the housing crisis really compounds things. The lack of affordable supportive housing, is leaving many at risk of homelessness, which really only further acts to deteriorate mental health and physical health. And so it's a bit of a bleak picture. It's the need continues to far outstrip the available services and supports. And but I believe there's growing awareness. I believe there's a desire to act. I just think there's so much pressure on our health and housing systems that progress, as much as there has been, it's just we need so much more.
Yeah, absolutely, we do. And you've had some unique things happen in BC, right? With the decriminalization, we talked about that before when you were on, which you have people both saying that was the right route to go, and others not. And there's been some tweaks to that. You also were the first. You have a housing acquisition fund, which is very cool, which allows people to purchase housing, which now is hopefully spiraling into a national housing acquisition fund. So BC's doing some good stuff out there, but it's a distinct kind of difference, I think, in some progress and also some challenges as you've outlined. Rebecca, I don't know if you can speak to Ontario, York, Simcoe, but you certainly take up a large part of this province and have knowledge. What does it look like in your area?
So, it's the stats are, if you look at the stats alone, it can be quite dire. But it's changing so much. And I think what I want to kind of share with the listeners is to understand how much the conversation, the policy landscape is changing. And the good news is, when we look at how people are approaching homelessness, there's a lot of saying, no, we need to give these people treatment rather than we don't want to put them in jails. But then there's concerns around, well, what does that look like? Because, in Ontario, we just had a provincial government announce that they were going to close and defund safe consumption sites and needle exchange places. Not that there isn't other harm reduction efforts, and yet, flowing money into more treatment-orientated solutions, but it's not that full continuum of care. So the politicization of healthcare is greater than ever, particularly when it comes, I think, to mental health and substance use issues and behavioral issues such as gambling and things like that are growing. In Ontario, we're seeing the expansion and access of alcohol, of cannabis. And so our emergency rooms are flooded. The kids were seen at the most recent information that came out of the Centre for Addiction and Mental Health, CMHA's Ontario Student Drug Use Report. 37% of kids report high levels of stress that are preventing dysfunction, that are causing dysfunction, and rates of suicidal ideation, harm, self-harm are up higher than ever, with over 30% of kids. So we are seeing it on all ends without really comprehensive strategy. But we do have the initiation of the Ontario Centre of Excellence for Mental Health and Addiction. And so that is trying to move from a very segmented, where everybody's kind of doing their own thing, to implementing best practices across the province and standardized care. But that takes a long time to get there. And so what we're seeing is they're trying to build this unbelievable infrastructure, and at the same time splattering paint everywhere, trying to help and trying to sort of help those needs, because 20 people are dying a day due to an opioid overdose. So we're scrambling, but we're trying. And I can tell you, I don't know any mental health people who are mental health who aren't working harder than ever. We're happy with the empathy. under incredible, as Keir said, incredible system strain. Really, and from that place, innovation, access, trying to adopt new technologies, and sometimes when these burning platforms, really good things start to happen. But we need, again, from that catalyst, we really need the government infrastructure and the funding to continue that good work, find it, support it, because with any kind of healthcare, it is not a one and done, right? We need to have long-term solutions and support, particularly for people that have had long-term struggles.
Yeah, well said. And I love how you said, like, hey, there's progress happening, not enough. This takes time. Absolutely does. You both mentioned during your intros just that crossover. This is kind of a housing and homelessness podcast, but the overlap with health and mental health in particular, and addictions, etc. I mean, is always there. I don't think CMHA or Coast, were you always, housing didn't always play a part in it. I think it's just, can you talk a little bit about how housing in your organization kind of evolved and why it's important and what role it plays? We'll start with you, Rebecca, and then go to Keir.
Well, actually, we've always housed the mentally ill. I mean, before we put them in institutions, we've always housed the mentally ill. But the way in which we believe now in recovery, in housing as a right, and for those with substance abuse, a housing first model where we, stabilize housing and then and understanding the social determinants of health, that's really changed. And so how we house people, if you work in mental health care, is changing, from this very custodial, patronizing, model into really understanding and the dignity, the capability, understanding that people with substance abuse issues, are actually healthy people underneath, right? Like they are not their illness. And when we can treat their illness and support them, then they are the same healthy functioning people underneath. And in fact, all of us can if we are faced with an illness, can become that, and we don't want our rights taken away. So that recognition has grown, and in the past 12 years, we went from 24 units, as I said, to over 420. And it's a range of units. We still do support people who live in congregate care settings because that's the right setting for them. And we have a lot of people that live independently with rent supplements or live with their families. And so housing and housing stability as part of what somebody's needs are, because, at the end of the day, you can clinically treat, you can treat and you can reduce symptoms of mental illness. But we always say mental health is a home, a job, a friend. So all of my clinical teams, my psychiatrists, they can prescribe all the medication you want, but you're not going to have mental health without a home, a job, a friend. And so housing, as part of that mental health well-being, ability to stabilize and support health overall, is recognized as an evidence-based best practice, and really is a human right.
Wait, so let's look at home, a job, friend, right? Those are
Yeah.
So, okay, a home, a job, friend. Awesome. I love that. Well said. Keir, what about yourself? What part does housing play?
Well, it's interesting when you name that a home, a job, and a friend, because post mental health, our three pillars are housing, support services, and employment. So very similar organisations in terms of focus and the way in which we provide that care and support. As I touched on earlier, housing has always been an early and important part of the work we've done. Today we operate a bit over 1,000, units or homes across the Lower Mainland, and like Rebecca touched on, about another 300 to 400 rental supplements where we're supporting people in the private market and community and following and supporting them in that sort of more scattered model setting. I think the bigger difference for us is supportive housing. Coast got involved in a bigger way probably around 2010. And that portfolio grew to nearly 400 units alone over the last decade. And so we've seen, even thinking about how that, because that's about when I came to Canada as well and working with BC Housing, and just seeing how that environment has evolved when those buildings were opened in 2010, 2012, what the population and the needs, even quite frankly, what the service and support levels looked like in those environments to what when you open one today, or what the population and needs look like. There has been a dramatic change. As Rebecca touched on as well, when we think about substance use, really the overlapping and co-occurring challenges, whether it's physical health, mental health, substance use. In BC, our last homeless count, we saw 69% of people had been unhoused for over a year. So when we think about a homelessness response and the environments and the situation people are coming from, entering a shelter which has little to no health and mental health supports or straight into housing, we're still to this day, there's very few programs that really have those key psychosocial supports to help stabilize and move people forward. I think, that's been one of the greatest evolutions, I would say, in terms of the complexity and the need we're seeing, and really where we're all trying to respond and the system's trying to respond. In the other world, serious mental illness, like that environment's been somewhat stable. We have seen an evolution from trying to respond to people that may resume substance use, and traditionally mental health and substance use haven't worked well from a licensed mental health perspective. So those systems of care are trying to evolve. But I think the biggest challenge we've got, and we see this being the most visible one, here talk around public safety, growing homelessness. Well, it's then how's the system sort of not just providing the infrastructure and housing, but it's the services and supports that are often in greatest needs to sort of receive and support people when they come inside. And there's been some great progress, but I think so much more still needed to really help people, have access to the appropriate care that they need to really thrive and move forward with their lives.
And let's stay on that kind of positive art. What are some of the positives that you're seeing right now? Some of the good things that are happening?
Well, you touched on, I think BC has been more aggressive than any other area in Canada in terms of housing reform and policy. So, we have built record numbers of affordable units, of even supportive housing. We've seen an investment in a number of, integrated care team models. So look, there's no doubt that there has been an urgency and an effort to respond and really to understand the housing crisis that exists, and really the recognition of the opioid crisis, which Rebecca touched on before, which has claimed nearly 15,000 lives here in BC since the public health emergency was announced in 2016. So this is a complex challenge in these overlapping crises. And so, again, we can see that plane being built on the fly, as but it's just such, you throw COVID in there and the unbelievable strain that put on the healthcare system, that there is no shortage of effort. It's just now the cost involved to sustain and stand up these services, and can that be sustained? But again, positives, growing recognition of need, growing recognition of the intersection and overlapping of these issues. And I believe the desire is there. It's just, I would also note Rebecca's comment around the politicization of some of these issues before, and we're heading into an election next month, which will, again, we've got a really strong conservative wave here with the BC Conservatives, and even a walk back and a shifting to the centre from the NDP, who had been really aggressive from some of the policy reform. You touched on decrim. So it's an interesting political landscape that we need to get through this election to really get a better understanding of how we can move forward as a province to meet these needs.
Yeah, I mean, it's right. Things can be, we see it time and time again, where on the right track, election, things change. Sometimes for the better, sometimes not. And definitely in BC, in our nation, that will go into an election in the next year and a bit, probably a year from now, but who knows, and maybe even earlier in Ontario. Rebecca, what are some of the positives that you're seeing in York, Simcoe, Ontario?
So I think one of the highlights, I think, in the last couple of years is the launch of the Ontario Structured Psychotherapy Program. Now, this is free cognitive behavior, evidence-based therapy by clinicians for all of Ontarians, right? And it's a step care model. It's measurement-based care. It's equal access with an equity lens across the province. I think it's a tremendous effort. And it's continuing to evolve, and that we can see the results to support people with mild to moderate depression and anxiety. I think that's an incredible investment. in terms of early intervention and to look at that. There has been tremendous investments, not enough by population, but there has been tremendous investments, and really looking at equity focused investments with huge efforts to support Indigenous, Métis, and Inuit communities, rural communities, and how we use video and video conferencing to ensure access to psychiatry across the province, to make sure that people do have access to care that before the pandemic people just didn't. And so those are really great. And then I think, and we'll talk about this, there really has been an effort around integration and co-location, and how do we make access and navigation easier for people. And the last, thing that I think is so important, and I'd be remiss if I didn't bring this up, is the recognition of peer support. It's provincially funded. It's almost standardized now that people understand the value of peer support. That lived experience and lived and living experience are embedded now in all service design. It is an expectation that we work with people to get their advice, and that we're co-designing services. 10 years ago, we just didn't do that. And that is so important, because it is the people that have recovered or are struggling that tell you what they need and how to do it. And I think the fact that providers and governments are listening is so important, because that's where the system will develop in a better way over time. And I think the focusing on quality and quality improvement and standardization is really where we need to go, to make sure that we are finding equitable access. And so those are the things, and there's a lot underneath all of that, but there's been more. There's not enough, but there's been more, and we're starting to learn the right things to do, and sharing the information. Podcasts like this are just such a great opportunity to connect people to these ideas, and so grateful for you for leading this work, Michael.
Well, incredible strides. I mean, that's so cool, and it didn't come without a lot of people with a lot of. I mean, just think of the efforts, the advocacy, and the all along the way. And so we started with the positives, and I know there are many challenges. What are some of the bigger challenges, Rebecca? I'm going to go back to you, and then we'll go over to Keir. What are some of the big challenges ahead of us that we need to work through in the coming years?
I think the opioid crisis is an unbelievable challenge. I think the nature of street drugs is changing. I think that every time we think we have a handle on it, there's another supplier. We seem to be supplies outpacing our ability. And if we don't do a proper 4 pillars approach, we're really not going to get there. And so the systemic challenges are going to really hurt us in the long run. In that sense of, we had a housing crisis, 20 years in the making. We're not going to fix it in a year and a half or 2 years. And so what do we do in the interim when people are dying? And how do we save lives? And in that saving lives, how do we make sure that we're doing enough work on prevention and early intervention, so we're not just keeping to save lives? And so that tension between this intense need for crisis services and supports, and really you can't argue with an emergency department that is overflowing when in that moment, like people are dying, we have to save their lives, and yet at the same time we need to equally invest up front with governments that are struggling with their budgets. And so I have a lot of empathy and compassion for decision makers, because these are not easy choices to make when there simply isn't enough. And so the use of AI and technology, and how do we actually do things better and smarter, and how do we partner and not duplicate? How do we understand, we're beginning to use data in ways that are smarter than ever before, but at the moment we're not there. And so we're still kind of stumbling around, trying to do, again, like the best we can. Like I will tell you, my staff, and I'll speak to the staff of my partner agencies, they could not care more. They could not work harder. They work extra hours every day, meeting people where they're at, I can tell a story. We had a young woman in our Mobies program, and for people who don't know, across Canada, Mobies was the first mobile clinic in Canada to go to high schools, staffed by a nurse practitioner, a youth mental health worker, and a peer, providing full health care and mental health care. And a young man that was a client texted one of our staff that he wasn't feeling safe and that he was going to take his own life. And she spent 7 hours by text, harrowing hours by text, because the young man didn't want to tell his family and he was afraid if he talked. 7 hours to save his life, to get the police there. And the wonderful story of that whole thing is the parents did care, and they followed that kid to the hospital behind the police. But that was 7 hours that she spent over the phone. And that's the kind of staff that are in mental health care that we don't really celebrate enough, especially community care. And I'm so proud of my team because I have a zillion of those stories. And so there are challenges because I don't have enough staff. And my staff, the HHR crisis and the wage discrepancy, they need to be compensated for what they do and to understand the value that they bring. And it's so hard to tell those stories against, larger institutions. But at the end of the day, that's a challenge. We need the right investments. We need to ensure that there's a strong, healthy community sector with staff that are supported to do this work, that the government is investing in the data infrastructure so that we can do the right evidence-based care. And we need to support innovation, and we need to support, more research into community-based services. So I didn't really talk about the challenges in the sense I kind of came at it with solutions, knowing that I think we all see enough of the stories. It doesn't take much to walk downtown and just and that's just the face of what goes on. We're Michael, York region, for people who don't know, is the suburb of Toronto, and it goes from a very sort of urban population all the way up to farmland and rural. And homelessness for us looks so different. As and people, you don't see them on there's nowhere that they congregate. They're behind dumpsters or in old farmhouses and barns and buildings. The challenges of reaching people who desperately need our help at a young age to get them to care is the challenge that we're facing. So lots of challenges, but that only makes me want to get up in the morning.
Well, listen, you know what makes me want to get up are stories like you just told, when someone spends that kind of time on one person. That's incredible. And it leaves us, this is a hopeful podcast, right? There are a lot of challenges out there, but you can't help being a leader and saying, I'm going to focus on solutions. I think that's leadership. Yeah. Keir, what are some of the biggest challenges you're seeing right now in BC beyond the upcoming election?
Yeah, I think a big challenge we're facing is the public is tired of these multiple crises. They're tired of homelessness and not seeing tangible solutions or understanding, what are the solutions. Tired of the rhetoric around public safety and violence and not feeling safe in their communities. They're tired of what they believe is a failed decriminalisation experiment, which really had nothing to do with decriminalisation, but really these other overlapping challenges around, increased number of unhoused individuals and the toxic drug crisis. So it's, I would just say there's fatigue in the public, and therefore gaining support for responses and not having divisive politics that really just take us down the wrong road. I think that's my biggest worry, and the biggest barrier I think we're facing is it's hard to look at politics out here and see hope and that there's a solution. So I think that's what I'm hoping, is that we can get to that place where there are solutions, there are things that people are doing, there are steps we've taken, and we just need to keep heading down that road. The other big worry I have, and we're only just starting to talk about it, is just the significant proportion of brain injury, often associated with the toxic drug crisis. Even the homeless count showed this for the first time, that 30% of respondents identified an acquired brain injury. We're just not really talking about it. The services and supports aren't in the settings where people are. overdosing and living. There's that cohort that we're only just starting from a system perspective to understand the problem, let alone design some of the system solutions that will for many require ongoing care. We've seen some of our treatment programs really shift in acuity from really the serious deterioration of cognitive functioning, so that, often in the substance use and treatment recovery sector, it was, I wouldn't say easier to take some of those next steps, but when there are these brain injuries and cognitive impairments involved, like there's repair, restoration time, and for some there's some permanent damage. So I don't want to harp on that one, but I really hope we can continue to talk about that, Rebecca. I don't know if that's been talked about out in Ontario that much, but it's only just garnered some more public attention in the last few months. And so I think that's a barrier to really helping the population that is overdosing and living, let alone the dramatic loss of life, as I touched on, that we're seeing as a result of poison drugs. So many barriers, but again, I continue to look, like Rebecca touched on, to there's so much hope, and so many amazing organizations. And again, speaking of the staff, the commitment, everyone works for organizations like ours because they want to make a difference. They believe the work they do makes a difference. They get that direct care and support, helping individuals every day. And we know there is progress. We know we're helping people move forward, but these systems are such large and complex beings that my biggest worry, outside of what I've named already, is really it's funding. We have been spending, and I think this is part of the challenge in terms of people not seeing progress. And so how do they continue to support the need to be doubling down in these investments, which are necessary, when people just aren't seeing, that we are making progress, and that things, in fact, people feel are getting worse. So I worry about a defunding and we're seeing that in some areas, just these, we've seen it historically, reducing investments in social services. And I just think that could be the worst step that we could make when we still have so much progress to make.
Yeah. Well said, right? I mean, I think there is the thought of if we did nothing, people would be shocked at how quickly you slide backwards, right? Defunding, doing that. It's sometimes, well, you're not moving the bar, so why keep investing in, right? It's just like people should bootstrap up. And then you think of that Martin Luther King quote of, it's hard to pull up your bootstraps if you don't have boots. And they don't, right? I mean, I think, and we've seen it happen before, right? I've talked before about before 2010 in the UK, they were making significant strides in rough sleeping, reducing it, changing government, backslide over 14 years, and we're back to pre 2010 levels. We in Finland, a country that has talked about being very close to ending chronic homelessness, and talking to CMHA in Finland, it was talking about how they've had a change in government and some change in policies, that they've had a little bit of a backslide, right? So it is not, and I think, Rebecca, it's not one and done. Like there's like, hey, here's a treatment, you're good, and move on. There is long-term investment, and Rebecca, I also like what you're talking about, and with reacting to so many things happening, it's so important to remember we've got to invest upstream, preventive, right? Do those pieces, because we'll never get ahead of it. It's just an ongoing cycle. If you don't start saying, what can we put in place way early on, right? So we're not, seeing this crisis grow going forward. I mean, you're both, I could talk for hours about this with you. It's incredible. I want to talk about, you're both doing cool stuff, and I want you to give, I want to give you a moment to talk about some of those things. Keir, we'll start with you. What's going on with Coast? What are you really proud of? What's something cool you're working on right now?
Yeah, there's a couple of projects we feel like we've been working on for a number of years now that are getting close to opening. The first is an expansion of BC's announced this Road to Recovery initiative, which is really what are labeling a one-stop shop from people coming into hospital emergency, accessing detox, stabilization, and treatment all under the one roof. And so that's now up and running. But we're getting involved to open really a reintegration program, and that next step, and that important next step for people, that when they leave that hospital environment or that treatment setting, where do people go? So in the next couple of months, we'll be opening 25 units to take a small step to help people on that journey, and really reconnecting them with permanent housing, those vocational services that we talked about before. So really excited to be part of that provincial initiative that I just think when we talk about integrated care and our systems of care, it's just a really great example of where I think we're seeing some of that progress and alignment. The other one is probably many years out still, but really our most exciting project is the redevelopment of our current head office and mental health clubhouse in Vancouver, which we expect and hope to bring close to 500 new homes to the community, including 370 non-market rental units, thanks to support and announcement from BC Housing earlier this year. And what we believe will make that unique is really that this project will also feature a specialised community health centre, mental health centre, which we expect will provide a wide range of integrated services and supports. And it is early days, and I have been looking across the province and what Rebecca and others are looking to do, and so really excited to see new models of care that we can learn from and replicate. And so, as I said, early days, we're probably 5 to 7 years out on that one, but probably the single biggest thing that our agency has done or will do for many years to come.
Well, lots to be proud of. That's incredible. Thanks for sharing. And you touched on, I don't want to take away, Rebecca, you can talk about anything you want, but I know there's a passion project that you and I talked about for a long time. And there was moments when, I knew you never would, but you talked about, maybe I throw in the towel. I'm like, that's not going to happen. But you didn't, and good things have happened. You don't have to talk about that, but now you're going to leave listeners wanting. But I think you should.
You know what? Thanks for the softball. I am so excited. So CMHA is a lead agency, along with 20 partners that include 3 acute care hospitals, the police, the paramedics, housing providers like yourself, public health, all of our fellow mental health and addiction and social service providers. We are opening up what we know is Ontario's first, and I think a first in Canada, what we calling the York Region Mental Health Community Care Hub. But what it really is it's a place where our vision is what needs to change so that somebody's first crisis will be their last. I'm going to say that again. What needs to change so that somebody's first, so we want to solve crisis. There are 20 beds. It will be for those who are 16 and older for short-term stabilization, and it will be for ages 12 and up. So we will have children and youth specialized mental health care, adult care. We're going to have Indigenous specific and led services, as well as looking at services that are focused for different equity deserving groups. But this is really an alternate to emerge for those who do not require medical care. So it's, as I said, so it'll be a 24/7, and it is not a hospital. And so, when I was trying to explain to somebody, I said, well, I have a 13-year-old, and, if that is so overwhelmed with anxiety that they can't go to school, like, what does my child need to know before they even show up? As a parent, what do I want them to, what would they want to know before they even go in the door? And then what would the school need to know? And then once they're there, what is the environment and the care experience that happen as soon as they get there that starts to promote recovery, but empowering that individual? And then the treatment that's provided, how are they then connected to ongoing care so they're not just stuck in that wait list of, and waiting for, like, how do we immediately connect them to the services and they are empowered in those services so that we're meeting the needs and the crisis that got them there in the first place. And that doesn't mean we're not going to be there and serving people that have been in crisis for a long time and supporting them to get out of crisis and into good and better health. But the other part of this is we're absolutely committed to being a learning health system, a learning health organization. So every step of the way, how are we evaluating and working with what we're doing, and we're working with university partners to build research and education right into this so that we can actually, over time, if we can solve crisis, we can get out of all of these kind of, huge systemic problems that we have now, because we know from a lot of research, and certainly CAMH released their research recently, we know that over 78% of people that end up with a psychotic episode were actually seen as a child for different mental health related issue before the age of 12. So they're actually already identified as children who need care, but they're not getting service, and they're ending up in psychosis related and other more significant serious mental illness. So we want to really work and focus in on working with our partners around how do we get upstream, how do we provide those resources, how do we set those comprehensive strategies so that we can actually get out of the system that we're in right now and build a better healthcare system. And so that's what I'm really excited about. We're right now in an amazing design phase, and then we will be launching in the spring of 2026. So, and again, this is 20 people coming together. So a really exciting time. And thank you for giving me a chance to share the story of the Mental Health and Addiction Community Care Hub.
No, you're both doing incredible work, and we're going to leave on those super positive notes. But for people who want to either support Coast or CMHA, where do they go, Keir? We'll start with you. Where can they go to find out more about the awesome stuff you're doing, or if they need help, or if they want to donate?
Yeah, the best resource is still our website, coastmentalhealth.com. We'll have all the major social channels as well if you want to hear some of the latest and greatest work that we're doing, but definitely can access all of that information on the website as well.
Yeah, and I'll say the same thing. It's Canadian Mental Health Association, York Region says Simcoe, to join us and learn about this hub and this model. And really, whether you're a provider or you're looking for care, we're always there and happy to help.
You're awesome. You're both all over socials as well. Check out both Keir and Rebecca on social media, on LinkedIn, and their organizations all over socials as well. Be part of the solution. It's the best way to move forward. You're both incredibly busy people. I so appreciate the time and all the passion you put into this work. Thanks so much for joining us on the show today.
Thank you, Michael. And thank you, Keir. Absolutely love this conversation.
No, it was great. Thank you both so much. Bye.
Bye-bye.